Welcome to On the Line, conversations about insuring what matters most, presented by Mainline Benefits.
So today we're asking a dangerous question. Do you actually need the healthcare system or just better guidance? So I'm Arnie Eloff with On the Line podcast from Mainline Benefits. And I'm here with Dr. Greg Seaman and his office manager, Veronika. Welcome.
Hi.
Hi.
Yeah, so welcome, doctor. So I got a chance to meet you. It's probably been at least 10 years, I think.
Yeah.
Right? At least 10 years. So obviously I have health insurance. We at Mainline obviously work with health insurance. We sell it, and you work with a little different type of healthcare. And I was looking for that to get just some better health as opposed to just going to see my primary care physician. And you've really helped me get to a place where I just not healthy, but like to optimal health, right? So tell me a little bit, maybe, I don't know, do you want to start with what you actually do? You want to start with how you got into it? What would you like to start with?
Yeah, I guess wherever you want to start. We've known
Okay.
each other for about 10
Yeah.
years. And really, I always tell people our job isn't to take the place of your primary care doctor. It's really to make their job easier. So we kind of look at more things and approach it in a bit different way than traditional medicine does.
Yeah, so one thing I just found out that you're actually looking at actually writing a book about your move from being that anesthesiologist to what you're doing now. So you want to give a little background on it? Because, well, actually here's there's a lot of clinics out there that do IV treatments and do this and do that. The thing that's pretty cool about you is you literally are a medical doctor, which is, but how did you actually get from being that and doing the anesthesiologist to now doing what you're doing? And I want to let you better describe it than me describe it.
Yeah, I think it's kind of an interesting story. I mean, when I was in medical school, I took classes on my own time and money on what was called anti-aging medicine then. So really being proactive, preventative with your healthcare is always kind of the way that I thought it should be. It just works better, like changing the oil in your car instead of running the car until the engine seizes. So I ended up going to Michigan State Medical School, which is a primary care school for the most part. They make primary care doctors. And I thought that would be I would feel very helpless to do primary care and tell people to stop smoking and lose weight and see them in a year and have them done neither of those. So when it got time to choose, I actually chose anesthesia, where if I want the blood pressure down, it's down in seconds. You have complete control while in the operating room. And then throughout my career, putting people to sleep, you find out that so many people have to get put to sleep to have part of their foot amputated because their diabetes is so poorly controlled that I really got figured out that people are taking it seriously. They just didn't have the tools. And so I kind of transitioned back into what we're doing at ThriveMD, which is, it's more like primary care. Like I said, we don't take the place of a primary care. We don't claim to be primary care, but really we're helping people with that foundational need and being healthier in general.
Got it.
I think that's one of the areas where there's only so much that they can do. In the system that we have, your doctor may have 5 to 10 minutes with you, and there's not a lot of time for stressors or everything else that goes into making you the person you are, which I think is invaluable as far as your medical care goes. And the system's not set up to have the time for that, really.
Yeah, so one of the reasons we looked at bringing you on board for a couple reasons, and by the way, we talk a lot about, we do health insurance for individuals, we do Medicare for seniors, we also do group health plans, and ThriveMD is actually one of our group customers. So thank you for that. And but there's just right now, with a lot of the changes just happened in the pricing and the subsidies changing, some people are really looking to go without insurance. So how would you be able to help somebody like that doesn't have insurance?
Well, unfortunately, nothing we do is really billed through insurance. Like I said, it's kind of above and beyond what the insurance model covers. But yeah, we have insurance with you guys. It's worked out very well, and I think that's critical. I tell people all the time, I have health insurance if I get in a car accident or have a heart attack or something. But a lot of the health things that I do, I have to seek out on my own, and it's kind of out-of-pocket expenses. But insurance, I think, for most people, I think it's definitely a must.
Yeah, correct. So let's be clear. We're definitely an advocate that people should get health insurance, right? We're not an advocate for people not. And some people are just saying, kind of screw it, or I can't afford it, or I don't want to keep paying for it. So one thing you're definitely able to do is help people stay healthier. And one thing we can do, listen, an accidents happen. So
Yeah.
when an accident happens, we also can help somebody with very inexpensive accident insurance that would take care of them for that. But yeah, even if whether they have insurance or not, just helping them keep healthier is kind of what you're doing.
Yeah,
Right.
it's interesting because at our office, a lot of the people that come there aren't Americans. It seems like Europeans typically look at that more as the normal course of action, where you're going to pay out of pocket for these things that are above and beyond. The health insurance or the Western medicine system gives us kind of a foundational approach, and it does. It looks for a lot of things when you're sick. We work with a lot of people that want to prevent getting sick. So yeah, of course I recommend people have insurance. It just doesn't help them much at our office.
Yeah, got it. Got it. So, hey, Doc, I know you brought your office manager, Veronika. Do you want to give a quick introduction? And Veronika, we'd love to hear a little of your story.
Yeah, so Veronika joined us about 9 years ago. She works along with Sana, the office managers at our clinic. And Veronika, I believe you started at the front desk, right?
Yeah, I started at the front desk, then ended up being your assistant, and then all the way to practice manager.
Got it.
Yeah.
And so do you use the treatments yourself?
100%.
Yeah.
Yes, I do. So I had like a really
And by the way, we do have a dog running around that I don't know if the dog is here. What's the dog's name again?
Misha.
Misha. So
Yes.
the dog's either here to comfort you or you're here to comfort the dog. Which
Yeah,
one is it?
a little bit of both.
A little bit of both. Okay, good. So I don't know where she's at now, but we'll get her in here in a little bit again.
Yeah.
I'm sorry. Go ahead.
Yeah, so when I first started, I was always into alternative medicine. Growing up, my mom used to do like parasite cleanses on me all the time and take a lot of vitamins and supplements. And when I actually started, I had a really bad case of eczema to the point that my hands were cracked and bleeding and everything. And I started doing all the therapies, and now this is 9 years later, and I'm like completely 100% like, not to say cured, but no more eczema.
Yeah, got it.
So I firsthand know how these therapies work and how to really, how do I say, how preventative medicine is just critical.
So yeah, so Veronika, what are you seeing? Like when patients come in, I don't know who's going to be better to answer this question. I'll let you guys decide. Like, what would be your typical patient that would see you? Why would somebody come see you?
Oh, we would have anybody from cancer patients to, like you said earlier, professional athletes, people who just want to optimize their health, or patients who tried everything else, all the Western medicine, and this is like their last hope. So we see a wide range of patients every single day.
Got it. Yeah, so that's how I personally got into alternative medicine myself. It's a long story. We're not going to get too much into right now, but got bit by a monkey, and I couldn't find anybody to treat it. And I ended up using acupuncture, chiropractic, Chinese herbs to do it. And I've just always believed in it ever since. Obviously, I have insurance, and I'll go see my PCP if there's something going on. But I love other types of treatments out there, or other types of treatment. That wouldn't be really the right word, though. Treatments. What would be the right word, Doc?
Yeah, we technically don't treat anything because we've talked about this before, but the things we do are not FDA approved treatments. And I don't mean to make light of that. It's the FDA approves therapies for certain conditions, and those aren't typically the things that we do. So we use the word therapies, and we don't want it to be misleading. We might do a lot of different therapies for somebody with any number of illnesses, and we're not technically treating that illness. Our goal, I guess, is to always make the body healthier with the hope that the body can figure things out. If we just detox and help the cells make energy, those sorts of things.
So, what would be a typical condition somebody might walk in the door with? That
Mold.
mold?
Yeah, we see a lot of mold. Yeah, it's
How
interesting.
would somebody know they have mold?
Well, most people don't know they have mold.
Okay.
When you get further on down, the person's going to have some type of chronic illness. So it's interesting to see what people walk in with and what they end up leaving aware of, or at least working on. So somebody with chronic fatigue, say, we see a lot of that. Somebody with chronic fatigue may end up having a combination of mold and Lyme. We're always looking for things that are suppressing the immune system, making the body work overtime, essentially. And then we have special testing for that, and we have protocols to help the body get over that. Again, I don't really say treat because we're not treating it.
Yep.
We're just trying to help the body to get past that hurdle. And when we get enough of these things back online, the body kind of takes off and does the rest of the work itself. That's always been my theory. That's the best thing we have going for us, is the body's designed to heal, and it's really well designed. So we try to work with it. We use things like oxygen and light therapies and a bunch of different stuff that work with the body to make it function better.
Got it.
Yeah. So Arnie, before we go further,
Yeah.
I think it's pretty interesting how you came to see us. You mentioned
Yeah.
bit by a monkey. Did you
Yeah.
literally mean bit by a monkey?
I literally mean bit by a monkey. I used to have a couple, and yeah, I was messing with it a little too much, and it didn't like it, and bit my finger. Not a big deal from the monkey side, but yeah, that's whatever was in the monkey's saliva didn't mix too well with my blood. So
Yeah.
for about 6 months, I was in pretty bad shape with that.
So did
Yeah.
you just sort of start getting symptoms like being sick, fever, that sort of
Yeah,
thing?
it all started. Yeah, I could barely breathe for a while.
Oh.
So yeah, this was all before I would have met you, but it got me in the whole realm of understanding the alternative. But yeah, I had a hard time breathing. I had a hard time eating, sitting down, standing up. It was for about 6 months. I went to doctors. I went to vets. Even I went to hospitals, and yeah, it was yeah. It was Chinese herbs and acupuncture, chiropractor. I'm a big believer. And again, not to take away from anything on the Western side, I also had a really, really, really bad accident right before I met you, actually, and punctured my intestines and told my wife I had 24 hours to live. So I've used the insurance. I've seen it. And thank God I had actual doctors to take care of me for all that and a bunch of surgeries from it. So, but I look at a lot of times that's really kind of treating it versus what I love about coming to your practice. It's really so I don't have to worry about treating something. It's keeping me healthy.
Right.
That's what I love about it. I don't know if you want to talk a little deeper on that, or like the typical person that does come in to see you on that.
Yeah, it's always hard to say the typical person because like we said, we see from one end of the spectrum to the other. But a lot of people, I would say we can kind of divide them into two categories, like people that are sick or know they have a problem, whether
Yeah.
that's fatigue or Lyme disease or something, to people that aren't aware of any problem. They just want to be the healthiest they can, which I think is great. I wish more people thought of it that way, like being healthy today and maybe even more importantly tomorrow and 10 years from now. And
Yeah.
so I always think that long-term health is like a retirement account. It's something you start early. You can't start, the day before you're going to get sick or in your 70s or something. People do, and it's still beneficial. But the younger you start, the better, and the easier it is to do too. Like what a 20-year-old or 30-year-old needs is generally not the same things that a 50-year-old. So I think it's the mindset. And in this country, we're sort of, we think of it like you go to the doctor when you're sick. And in other countries, and the way that I think of it is you go to the doctor to not become sick. We see a lot of people. I just saw a guy 2 weeks ago, and he was diagnosed with leukemia. And he asked the doctor what he should do, and they said, "Well, come back in 4 months." And he said, "For what?" And they said, "Because then you'll be sick enough for the medication."
Oh,
And his point was he's trying to not get that sick, and that's how he ended up finding.
that is
us.
pretty crazy.
Yeah, it's kind of the way the system's designed, like we're not anti-Western medicine at all. We're lucky to have Western medicine, and things like penicillin have saved millions of lives. There's no question about that. We just think that there's a sort of steps you can take to try to prevent getting to that point. And you need antibiotics. You just need antibiotics. There's not much else that'll take the place of those. But there are a lot of things you can do before you need antibiotics, and maybe never get to that point.
Got it. So what kind of therapies, like someone that has leukemia, what kind of therapies do you have for them?
So we would kind of look at the whole picture. We generally start when somebody comes in. Our recommendation is generally to start with a full lab panel, which that's another interesting topic. But a full lab panel means different things to different people. The standard labs that you're going to get run at your primary care doctor's office is pretty bare bones, and people don't really know that because they're not the doctors. So I always say basically we can tell that you're not actively bleeding to death from that, but it's more like to make sure that you're stable. It takes a look at your kidneys and your liver and blood count and that sort of thing. So a lot of times when people come in, we would take a much deeper dive. We look at 80 some blood markers, 3 markers for inflammation, 3 markers for how your body's managing blood sugar. Those are 2 of the most important overall long-term things for really aging well. Blood sugar is one of those things that you don't feel any different if it's really well controlled or really poorly controlled, but it has a dramatic effect on the trajectory of your health. So we get a good handle on all those things. And like I said, even, in 20, 30-year-olds that really shouldn't have any type of insulin resistance or pre-diabetic conditions, but we get way ahead of that. And then we also look for optimal values. So there's a number called the hemoglobin A1C. That's a long-term average blood sugar over 3 months. Normal for that goes up to 5.6, and then from 5.7 to 6.4, you're kind of in this pre-diabetic no man's land, where they might tell you eat a little better, get a little more exercise, something like that. We're very aggressive in that area. When people hit 6.5, they're technically diagnosed with diabetes, and then the goal of therapy is to keep that number around 7. So our goal is to keep it 5.3 or less. We want very tight blood sugar control. And obviously diet's the biggest factor there, but there's a lot of other things that play into that. Stress levels, exercise, lean body muscle plays into it. So there's a lot of things that we can do proactively to keep that number optimal. And that really pays off over the long term in terms of health.
So I remember one time you described something like, and I don't know how to say it right, so I'm going to ask you to explain it, like talking about a car. And I remember when I came in, I asked you, hey, can I do this? Or can I do, like, no, we'll get to that.
Yeah.
But we got to do this first. So I know people want to get that quick fix. And
Yes.
one thing that you do, I believe is a little different, is you got to, I'm trying to figure out how to say it, but I'm just going to let you say it.
Yeah, I think that's a good point too. A lot of people will hear something about whether you call it biohacking or health optimization or whatever, just things that they can do, whether that's a podcast or a YouTube video on peptides or something. And yeah, those things are all great. I think they all have their place. I often use the analogy that if we're building the Sears Tower, the peptides might be the drapes on the 80th floor, which it's nice to have drapes on the 80th floor. But if you have a foundation crack, that's not really where the focus should be.
Got it.
So that goes back to that lab panel. You know, we start with that very extensive lab panel, usually the most extensive blood work a person's ever had done. And then I also explain it to them. Every test, you know, I tell them where this number, show them where the number is, tell them where we want to get it, why we want to get it there, and how we're going to get it there. So we come up with a plan. So at the start, the supplement recommendations that we make are all based on blood work. You know, magnesium is a big thing. A lot of people need more magnesium. We look at that in two different ways on the blood work. People might tell me, yeah, I'm taking 2 forms of magnesium or something. Well, what I really want to see is that blood level is where we want it, that you're getting that to the cells. That's the important part. So, you know, there's always the quality of the supplement and a person's ability to absorb it that go into making that number. But that's ultimately what we want to see. So wherever they're taking it from, whatever kind they're taking, there's different reasons for the different kinds. But what we ultimately want to see is the blood levels are where we want it.
Got it.
And I think the thing you were referring to, we talked about this before, but people will come in asking, you know, about peptides or something. And I often use the phrase that, you know, we want to make sure that there's air in the tires before we turbocharge the engine.
Yes, that was what it was.
Yeah.
So I had to be patient.
Yeah.
Yes. All right, very good. I do want you to talk about Lyme disease. I don't really understand it enough, but that's something I always hear about. And it's just, so from, you know, you help people with Lyme disease, but you also, to that athlete that I'm assuming is in pretty good health already.
Yeah.
So why would they come see you?
Kind of just the same thing. They want to be healthier. Obviously, they make their living with their body. That's a big important thing to them. There's a lot of restrictions on what they can take and can't take, but looking at the numbers and giving them ideas on where they might be able to find some benefit.
So literally just coming in just like a regular person off the street, just working with their health.
Yes.
Okay, got it.
Exactly.
Got it.
And a lot of the therapies we do, the IV therapies, you know, they're really helpful. And a lot of these guys are doing that stuff, have through their whole career. And they just found us, you know, when they moved to this area. But they're great guys. I mean, very dedicated, obviously, as you'd expect to their health.
Yeah.
Lyme disease is an interesting topic. You know, there's people out there that think certain doctors diagnose everybody with Lyme and almost as if it's a scam or something. And we don't spend a lot of time worrying about that diagnosis. You know, Lyme testing, I think, is the most difficult testing out there. The good tests are very expensive and they're still not 100%. So I hate to see somebody spend a couple $1,000s on a test if it comes back negative and I'm still not sure they don't have it. So it's almost the suspicion of Lyme disease is a big factor. And even if somebody has Lyme disease, if somebody comes into my office and they set down a positive Lyme test on my desk, that's usually not the first thing that we go after. I think Lyme disease, like cancer, my personal opinion, that we don't really get rid of either of those. The goal is to reset the balance with the immune system and live a long, healthy life and die many years from now, something unrelated, but it's probably with the Lyme disease or the cancer. So our goal is really to find the other things that are impeding the immune system from being able to reset that balance with those things. I have 3 different co-infections of Lyme disease, and I only know that because the company gave me a free test years ago to do it. I've never had a symptom I could relate to them, but I do things daily to keep my immune system in check. And I think that's really the goal. That should be the long-term goal. We don't want people to lose sleep over this stuff, you know, but just to have it in the back of your mind doesn't mean I'm never going to eat birthday cake. It just becomes the exception, not the rule, kind of.
Got it. So going back to, I know you talked about people coming in with cancer. So one thing that, you know, listen, some of your services that I don't know, how would you describe the cost factor of your services? What would be the best way to use, what words would you use for it?
Cost factor in which way? Like,
Meaning how much it costs?
So it just ranges on from therapy to therapy. We have anything starting at like $50 for vitamin D injections to a therapy called EBU. That's our most expensive, which is 1,500.
Got it.
So anywhere in between.
Yeah. So the point of it, sometimes people, you have to have the cash to be able to come in there, right? Because you're not using it for insurance. So when I know you talked about a person with cancer walking in the door. So again, one thing that's real nice what we offer is cancer plans. So whether somebody has health insurance with a cancer plan on top of it, or just again, for whatever reason, they don't have insurance, but somebody does get diagnosed with cancer, it's such a relief to be able to hand them a check for 50,000, 75,000, 100,000, and then they could actually do something like what you offer without having to think twice about it. So I just wanted to make sure we put a plug in there for what we do for insurance or mainline benefits. And so what about treatments that you do personally there? Is that too personal, or can I ask your favorite?
Oh,
Because
no,
you
no, no,
use
no.
some of the different.
Oh yeah,
Yeah.
definitely. So one of the biggest things that I've seen for my eczema was actually exosomes. So I did an exosome IV, and about six
I don't
months
know.
after
I'm
that,
sorry. Can you give a little more? It's an IV, a type
it's
of
an IV.
IV?
Yes, it's a type
Okay.
of an IV, and Dr. Seaman could probably explain exosomes much better than I can.
Yeah, exosomes are basically the signaling molecules that come with stem cells. So they kind of recruit stem cells throughout your body and tell your stem cells what to do, really. And all of these things, again, are kind of helping to strengthen or modulate the immune system.
Right.
So something like, eczema is an autoimmune condition. I think many things are autoimmune conditions. And in Western medicine, there's this belief that the immune system sort of gets the wires crossed, and it's attacking the wrong things. That never really sat well with me. I think, again, the body's pretty intelligent. So I think it's probably more likely that the immune system is suppressed and irritated by environmental irritants or mold, if you have mold colonized in your sinuses, or an old Lyme disease that a person has. And so we try to sort that stuff out, help the body detox, and a lot of times those things will straighten out. Again, we're not treating them, but the body kind of figures it out on its own and regulates things. And whether that's lowering somebody's, like TPO antibodies would be elevated with Hashimoto's or different autoimmune thyroid conditions. And we've seen those come down dramatically when somebody cleans up the diet and heals the gut and gets rid of the mold or the infected root canal or something in the mouth.
Got it.
Yeah.
So is there any fun therapies you're doing besides the IVs?
Oh, definitely. Like the red light bed. Absolutely love the red light bed. I try to do it 3 times a week. And we do have a cool.
So a red light bed. Just can you
yeah.
give a little desk? So you're laying. Is there like a tanning booth almost?
It kind of looks like a tanning bed, yes.
Okay.
So it's a 20-minute session, and there's different hertz for different conditions. So I choose the anti-aging. There is a pain one. There's a joint pain one. So there's a lot of different.
And you just lay in it.
You
then,
just
or-
lay in it, relax. I typically fall asleep.
Got it.
Yes.
Okay. What other therapies are in there?
So there's another therapy that I really enjoy called the hypoxic trainer. So it's
I'm
like
not sure how come I've never heard of any of these while I've been in it.
Oh, really? Oh
Yeah.
my gosh, this one I think that
Okay.
you would love. We actually had a patient.
Say it again one more time. The name.
Hypoxic trainer.
Okay. All right. So
Yes.
sorry, your patient.
Yeah, so one of our patients, well, there's many patients that do it, but one of our patients specifically is a marathon runner, and his stats were so much better, right? Afterwards, after he did 3
What does that mean? Those stats are better.
Like longer runs.
Oh wow.
Yeah, longer runs, quicker times, just overall.
So what is it? I'm sorry. Is this something you're laying in also to do it? What is it?
Yeah, so it's pretty relaxing. So obviously I like the relaxing treatments or therapies. Yes. So what you do, you just relax in a chair, you put the mask on, you preset the machine, and then you could fall asleep as well. And
Got
it
There's
lowers
some- yeah. Go ahead. Lowers.
your oxygen and then raises your oxygen. So it's like training without training.
Got it. It just reminded me. It's been a few years since I've used it, but in some, like almost I'm sitting in some type of capsule, and it comes. Is that for ozone? I think it was, or oxygen, or what? What is
Yeah,
that?
that's our Hocket. That's our ozone sauna.
Oh, is that what I was just? That's what you're just talking about?
No.
No.
That's something different. So what was the first one called again?
Hypoxic trainer.
Hypoxic. Okay, I'm not going to try to say that again. And then what is the one I did?
Hocket.
Hocket.
Yes.
Okay,
Yeah.
and it's ozone that it puts around you. Is that right?
It is.
Yes.
Okay.
Yeah. It's a form of an ozone sauna. It's a South African guy created it, and you're sitting in a chamber, like you mentioned. Your head
Yeah.
sticks out the top.
Yeah.
The only thing you can't do with ozone is breathe it. So there's a drape that goes around your neck, and then it fills the chamber with carbonic acid first, which actually dilates the pores and increases circulation, and then it sprays ozone into the chamber. So you absorb that ozone through the skin, and that's really good for the lymphatic system, for detoxing. The machine actually, it's Hocatt, Hocatt, and it actually does 10 therapies in a 30-minute session. But it's a great way to combine these things and get the synergistic benefit from them. So it's good. It's a refreshing 30-minute session. The other thing she was talking about was the hypoxic trainer. So I'm sure you're familiar with this idea of hormesis, where a little bit of stress.
I have no idea what you just said. Sorry, I don't. I can talk about deductibles and copays and coinsurance. Could you say that one more time again?
Hormesis.
Hormesis.
So it's the idea that a little bit of stress is good for the body. Anything
Okay.
from intermittent fasting to even exercise, you're putting a stress on the body. So with the hypoxic trainer, you're just breathing oxygen through a mask. And room air is 21% oxygen. So the machine will automatically drop that down to a preset number, between 12 and 15%. So some people train at altitude. The body just gets better at extracting this thinner oxygen from the air, basically.
Got it.
And so when you do this, it is relaxing. I usually fall asleep when I do it too, but it's the way to think of it is a workout for your cells, basically. Your cells are strained a little bit. Your body gets a little more efficient at what to do with that oxygen. And then, so people like distance runners, for example, that would be a good way for them to increase conditioning without flying to Colorado and training at altitude.
Got it. Yeah, so over the last 5 years, it's really been an explosion. People really putting way more focus on alternative and really getting healthier, right? And yeah, so how has that affected you guys in the practice and your passion for what you do? And who wants to start with that?
Well, I can start a little bit.
Okay.
I think that the biggest explosion we saw was after COVID. I feel like a lot of people were very scared, so they were focusing on their health. And the process of how a patient would come to the clinic would be they'd call the front desk. We'd get them on Dr. Seaman's schedule. Then a patient would have that initial consultation with Dr. Seaman and do our full lab panel and an ozone IV. And then based off of that blood panel, they would come back after a week and Dr. Seaman would give his specific recommendations. And I've seen such a huge change in patients. I do a lot of the patient follow-ups and give them a call, see how they do, and they actually feel incredible. Yes. So, and we have patients that we've been working like with you for years. And
Veronika, really though, you've been there 9 years.
yes,
Listen, Dr. Seaman's an awesome guy, but 9 years at the same place, right?
loyalty.
So there's loyalty. So, but I'm assuming you're not just there working. I'm putting words in your mouth, so you'll clean it up if I need to. Just, are you passionate behind what the practice is doing?
Oh, of course. I wouldn't be doing this if I wasn't, because it's a lot of hard work, a lot of research, a lot of continuing education and everything. So I just see the outcomes. I see the patients. I see this change people's lives. So that's why I'm passionate about it, and I do this stuff myself. And I truly 100% believe in it. And I 100% believe Dr. Seaman's vision and everything and how he approaches patients and his just way of thinking. Yeah, it definitely aligns with mine. And even with a lot of our staff, they come in, we hire a medical assistant or nurse that worked at the hospital, and then they don't expect to see this type of medicine, right? So then once they're in it, they want to do everything. And then even the other day, we were talking with one of our medical assistants, and she actually, I don't mean to bring eczema up a lot, but she had eczema as well. And she's like,
You just attract people with eczema. Is
yeah,
that what
right.
you do?
I guess.
But yeah, she's like, I think ever since she started working there a few years ago, this was maybe 3-4 years ago, that she hasn't had any outbreaks. And she did the Hocatt sauna, and we feel like it's maybe just the ozone in the air or something, because everybody's so much healthier than they were before they worked here. So yeah, it's really interesting.
Yeah, I think so much of it is sort of an awareness, really. I think Veronika mentioned the COVID epidemic, and it's not a political thing at all, but I think that made people more aware of it, of maybe their mortality, or perhaps with the limited information or at times confusing information we were getting from the medical side, people sought out on their own to sort of try to find answers or to be as healthy as they could. And that's always been my goal, is for people to want to be healthy. A lot of people, medicine is confusing, and a lot of people have their regular primary care doc and they just think, I'm going to put everything in his or her hands and I don't have to think about it. I don't have to worry about it. And I think a lot of people kind of woke up to, well, we really do kind of have to worry about it. Ultimately, the buck stops with me, so a lot of people started seeking that stuff out, and it has been an explosion. And, again, not political, but the current administration and their views on things. It just seems like it's changing. I can never tell because I spend all of my time in this office and dealing with people that look at health this way. But to me, it seems like there's a big movement with people, taking more responsibility for their own health. And the part you mentioned about, I think we have had a patient that had that coverage for cancer, and she did get cancer. And it was great because she still had the healthcare coverage to get, the oncology side. And I always think people should go through with that. Sometimes we can add things to what they're saying, or, they work on killing cancer cells, and we switch our work more to protecting healthy cells at that point. So it really is a good balance, and it worked out really well for her because she could do both of the sides that she wanted to do. She wasn't limited. I mean, you mentioned earlier about the financial impact of the things we do, and it can be significant. It doesn't have to be.
I know. I say my checkbook.
Yeah.
Yeah. No, I'm joking. It's definitely worth it. If you're going to put your money into something, why would you not put it into your health?
Yeah, I think,
Right.
when we say something's expensive, that's kind of relative to the value that we put on
That's
it.
right. That's why to me it's not. It just so I know I did make it sound like, but it's but people aren't used to spending that money out of their pocket. That's really the key. So even at $50, people are used to not having to do that. So that's the mindset with it. One thing that really can help people. So, we did talk about people having insurance or not having insurance, but we're definitely a big advocate of starting with truly an ACA plan. And that's where, honestly, there's a lot of agents out there that sell alternative products other than regular major medical, and they make more money on it. We want to start with a true major medical plan, an ACA plan. Even sometimes when we don't make money on the plan, it's just the right thing to do. But we, one of the things that Trump administration put into play is for a bronze plan, there's what's called an HSA, or a health savings account, that every bronze plan now has, where people can put together $3,000, $5,000, $6,000 a year into an account tax-free, and they can use it for these type of treatments, right? So that's what's pretty cool. So even at $50, or if it's more than that for it, it's there's a way for people to help pay for that with this thing called a health savings account. And I know we're not getting too technical with this right now. We'd love any of our agents at Mainline Benefits would be happy to go over it and talk about that. But I want to stick with you guys on it. But it's one way to help people pay for it.
Yeah, and a lot of our patients utilize their accounts as
They
well.
do. Okay, got it.
100%.
Okay,
Yes.
awesome.
I would say about like 75%.
Wow.
Mhm.
Okay, got it. Oh, that's great. That's really great, because that is on the individual side. So on the group side, a health savings account, or a lot of times it's called on the group side, it's not an HSA. It's not coming to me right now, but it's a different type where they, again, take tax-free money to help pay for it. But on the individual market, on the ACA market, most of the plans went away from having it. So it was a really nice move that now anybody on a bronze plan, no matter what the plan looks like, can be this HSA qualified plan where someone can do it. So it's great. I didn't realize 75. That's awesome. I'm glad we had a chance to mention that.
Yeah,
Then.
yeah.
Thanks for bringing that up.
Oh, yeah.
Okay, good. So I know we started out, that you were a board certified anesthesiologist, right? Am I saying that right?
Yes.
Okay. So how did you actually go from that to what was that real trigger that really something must have triggered? I didn't understand. I didn't know that you cared about it even way back in medical school, but something must have triggered leaving that, because that's a nice position, right? You get a nice paycheck for doing that.
Yeah.
And now opening up and going on your own and building the clinic you're building. What had you make that leap of faith?
Yeah, again, there's a lot of factors to it. I think the biggest thing, it was always my goal. That's why I went into medicine, was to help people. And then you get in this system that obviously it's helping people, but in a different way. It's not as proactive. It's not as preventative. A lot of times you're telling people to eat better, but what does that really mean? There's no guidance on that. And so, about 15 years ago, I actually had two tragedies in the family. I lost two brothers within 4 months of each other, both to freak accidents. And each time I was off work for a month or a month and a half, I think the second time. And that really gave me time to sit with that. And I guess it just puts everything in perspective, something like that. And I really realized that I wasn't doing what I wanted to do. I didn't realize the dream that I set out on. And I think that's why, I came back after that second leave of absence, and just my heart wasn't in it, really. And so I ended up leaving that job and started the company within the month. And that was back in April of 2013. And it's been great. You know, it's been more than I could have imagined. I did underestimate the magnitude of the leap. You know, I was starting a young family. I was recently married. Of course, medical school and everything, you get plenty of loans from
Yeah,
that.
yeah.
So I underestimated the magnitude of it. When we started ThriveMD, there wasn't really anything like that in the area. There were a few alternative, and I think alternative is changing over time too. You know, there's more options. There's a lot more awareness in the space. So yeah, that was back in 2013, and then I started off renting. It was literally a closet from a chiropractor. And then in 2014, I moved to my own space, and we've expanded 5 times now. It's, again, awareness in the space, more people doing it, but many more people aware of it. And it's fantastic. You know, I spend an hour, sometimes an hour and a half with people on an initial consult, and you really get to know the person. You know, that's what I was talking about earlier. I feel bad for primary care doctors. They get, 5-10 minutes.
Yeah.
And there's so much that goes into a person, stress levels and how you're sleeping at night. And, if your oldest kid's going off to college, like that's a stressor on the family.
So you literally get into all that. So how long, so again, we got 5 or 10 minutes, which again, there's nothing, it's not like day one only spend 5 or 10 minutes, right? It's just the nature of the business, really, right?
Right.
On the Western medicine type. And again, I'm sorry, how long are you typically spending with that new patient?
It's usually an hour, sometimes an hour and a half. So we really get to dig into some stuff and, find out what their concerns are and what their thoughts are. The professional athlete has a whole different view on what being healthy is than the person on hospice care. But our goal is pretty much always the same. We meet people where they are and we try to help them to be healthier.
Got it.
I've had people that come in before and they tell me I'm not going to quit drinking, I'm not going to quit smoking. And I tell them, okay, obviously, those things would be helpful to stop.
Yeah.
But just show me the playing field and we'll do the best we can.
Got it. So you'll still treat somebody or work with somebody like that. What would be the right way to say that?
Yeah, we would work with somebody.
We would work with somebody like that. So you just got to work within what they're willing to do.
Exactly. Yeah.
Got it.
If he's not willing to stop smoking, he doesn't need me to tell him that. Every doctor he's ever seen tells him
Okay.
that. So I don't waste his time. I don't waste my time. He knows where I stand on it. There's no question about that. But we do the best things we can with the playing field that we have.
Got it. So that hour and a half, that's after blood work, before blood work, where does that fit in?
It depends. Usually a lot of people aren't really sure what we do or how it's different or any of that stuff. So the first appointment, we talk about those kind of things. And then that's usually my recommendation is the blood work. And then we have another appointment. We go over all that blood work. And that's when I think the person really gets to see what the true differences are. Like a lot of people, they'll tell me, oh, my doctor just did a full panel. We talked about that earlier. That's, often 3 to 5 labs. And so I'll say, well, what did they say? Well, they said I was fine. And I always tell them, we try to set the bar a little higher than fine.
Yeah.
This is your life, right? We want to live the best life we can, no matter the situation. So that second appointment, we usually spend close to an hour again, and then we come up with sort of the outline of a plan, supplements based on their blood work and the symptoms and the problems they came in with, and then a plan going forward. And one of the big differences with what we do than Western medicine is, in Western medicine, I would tell you, whatever, take this antibiotic twice a day for 5 days or 7 days, and you're done. And that stuff doesn't really exist in the type of medicine that we practice. It's more like a flow chart because we're not sure what we're dealing with as far as toxins or how your body's able to make energy or anything. And then we're using your body to do most of the heavy lifting. So really, like we talked about earlier, we don't claim to treat anything, but we work with a lot of things. And we do that by trying to make your body stronger so it's better able to deal with any of the challenges.
Yeah. So, hey, a big buzzword right now is peptides. Honestly, I know the word. I know there's people use peptides, people talking about peptides. I'm not even sure exactly what they are, and I'm not even sure if I'm taking some or not taking some right now. I really don't know, but I know it's this big buzzword out there. Do you want to give a little bit? I may have just even explain when I'm saying peptides, what does that even mean?
So the definition of a peptide is a chain of amino acids, right? And there's a lot of different peptides that you could apply to different conditions. Like BPC-157 is a healing peptide. It could be used orally to heal the gut or by subcutaneous injection for any type of muscle or joint pain. Like let's say you have knee surgery. So what Dr. Seaman would typically do is, along with other therapies, but inject around the knee where you had the injury. There's also TB, not TB006, thymosin beta, which is another healing peptide that we would use in combination with the BPC. And there's also different things like CJC, which is a help stimulate your growth hormone. So there's a number of peptides that you could use for any sort of condition. There's some for bone health. There's some for weight loss, anything.
Yeah.
You want to, I have one question on this. So somebody, listen, there's lots of things on social media now with peptides, and there's just internet stuff. And what would be the difference between, if this is a comfortable question or not, about somebody just buying something off the internet versus coming into the clinic?
Oh, huge. We have all of our peptides through a compounding pharmacy. So a lot of these things that you do see online, you don't know where they're manufactured, you don't know where they're from. We've been seeing some like horror pictures that somebody reconstituted a peptide that they bought online for like $50. And when you look at the vial,
What does that mean, reconstitute?
so usually a peptide comes in lyophilized form, which is a powder form, and you have to add backwater in it to reconstitute it to make it into a liquid form.
Got it.
So we've seen somebody that has mold, literally mold floating in the vial after they reconstitute it from some unreliable source, some random website that they found it on.
Got it.
So it's really important to know your sources and to know where you're getting these peptides from, because you are putting them in your body. So you don't want to have an additional mold exposure through something that you're injecting.
Got it. So I'd like to go on that, but I don't want to, just with one thing you just said, how would somebody, listen, we're a national company. We're in all 50 states. People be watching all over. I know you're local here. I don't know where you treat people in other states or not. You could actually speak to that in a moment. How would somebody even find a doctor that would be reliable to work with them with this, or a clinic? What would you say? Or if someone came to you, like what would you say?
credentials?
Like, yeah, how would you say? Because I mean, just not only just somebody on the internet, but it might just be a clinic popped up, right? And I know there's a lot of places that just do IVs. I honestly, yeah, that might be great. I look at as IV and IV. I don't really know what's in that IV, I guess. I know I trust you when I walk in. How would somebody find a clinic in Arizona?
Yeah, you just got to do your research. You just got to call around and see how they prepare the IV, what kind of ingredients do you use. Like a lot of people don't know the difference between the vitamin C's. Like for us, we use non-corn vitamin
Is there more
C.
than one vitamin C?
Oh, 100%. Yes.
Okay,
There's
go ahead.
tapioca-based, there's corn-based, there's cassava-based. So it's really important not to have the corn-based vitamin C. And we make it a point. We pay extra for it. We do everything top of the line, highest quality ingredients for our patients.
I think one of the big things, like with a lot of things, like if I was going to get insurance, I'm not trying to figure out what insurance I need. I talk to an expert like you guys, and
Yeah.
I think there's a way, there's some groups out there like the American Academy of Anti-Aging Medicine, A4M. So they do training courses, and they usually have lists of people, or Ozone. Dr. Frank Schellenberger is one of the first people that I trained with, and he has a provider list on his website. Or Dr. Robert Rowan. So a lot of these people that do the training, they'll give you pretty reliable
Got it.
ways to search for a group that does it, because there's a lot of different trainings. And what scares me is you can literally take a weekend course on peptides or something, and then with the right license, you're out there prescribing peptides. And just because you're able to doesn't really mean that you should. I think it's important that people find someone that obviously they're comfortable with and with the person, and then is competent. Like we get a lot of people that come in and they went and saw somebody else and they did a bunch of peptides. They may have spent thousands of dollars on peptides, and peptides are great. They're not going to hurt them. They may even help them, but they're probably not going to fix something like we talked about earlier with the foundational crack. If you've got a foundational crack, you really need to work on that first. And a lot of people, they heard about a peptide, a podcast or something, and they're all excited. They want to try that peptide.
Yeah.
We just kind of try to tell them, now may not be the time. It may not be the most advantageous step at this point. So it's important to find someone that has a handle on all of the things. If you see somebody that just took a course on thyroid, they're going to treat everything with thyroid. You want to find somebody that's got a handle on all of this stuff, hormones and peptides and all of these anti-aging therapies. So it's good to find someone well-rounded. Peptides is a huge exploding market, and they're fantastic. I think peptides are great, but again, you want to make sure that you're doing it right. There are companies that sell these research-grade peptides, and I didn't know how big of a problem that was. Veronika and I were just at a conference.
Research grade is good or bad?
Bad.
Bad.
Yeah, they say right on the vial, not for human consumption. So they come from out of the country, and I didn't know that much about them. We were just at a conference in Las Vegas with the American Academy of Anti-Aging Medicine, and Dr. James LaValle. He's a pharmacist, writes a lot of books on peptides, works with the government and everything. He's really exceptional when it comes to peptides. And he was talking about the dangers of these research grade peptides. I've had people ask me about them before, and I told them, just because I'm a physician licensed in the state of Illinois, I could never recommend that to you. But I don't know how hard they would be to make. I'm sure there's a lot of smart PhD chemists out there that can combine these amino acids in the right form. Well, after that conference, he told us the hardest part about that is the solvent. So they put a solvent in there to get these amino acids to join in the chain that forms the peptide. And then I guess the expensive and the difficult part is removing the solvent. And he mentioned he does testing of them, I think, for the government. And sometimes they reconstitute the peptide, which, as Veronika was saying, that's adding bacteriostatic water, a water that'll prevent bacterial growth.
Oh, I didn't know. You said back. I didn't know what you meant by
yeah.
backwater,
Yeah,
spitting
that's
back water out or something. So
That's
bacteria water.
Bacteriostatic.
All right. I'll
Yeah.
let you say that word too. I can't say that fully.
It's just, it prevents the growth of bacteria. So obviously
Got it.
lowering the risk of an infection. But yeah, we call it backwater, but it's bacteriostatic water that you remix with the powder that is the peptide, and that reconstitutes the peptide into the injectable form.
Mm.
So he mentioned that when he reconstituted some of these peptides, you could smell the solvent in there.
Oh,
And that's really hard on the liver, and people get all kinds of side effects. And he actually, at this conference, he said his recommendation, there was probably 200 providers or so there, and his recommendation was that we don't work with people that are taking those. I've always told people, I understand where you're coming from. They're much cheaper that way. I don't really have a comment. I could certainly never recommend them, but I understand it's much cheaper. But after that, it's not that we won't work with them. I just make it very clear that I'd rather have you not take a peptide than take a peptide that's dangerous for you. I mean, that's a no-brainer, really. We don't want to do damage.
Right.
That's kind of the oath is do no harm. And I understand. I'm all for saving some money too.
Yeah.
But there's certain points at which corners shouldn't be cut, I guess.
Got it. So no, I know, Veronika, we've been talking a little bit more about, we'll call people with conditions. And my wife keeps telling me about some brochures. I guess I just bypass those when I walk in the door, or I just don't want to look that way. But she keeps talking about these brochures do you have in the waiting room, not necessarily about conditions, but about beautification or
Well, yeah.
skincare or something. What do you guys do with that?
Yeah, so there's many components of health, and looking good is feeling good as well, right? So we do have a really cool skincare line right now, which is actually a peptide skincare line.
Back to peptides.
Yes, it is.
Okay.
It's an OS01 peptide, and we
You
have
say that one more time?
OS01.
Okay, good.
Yes, peptide. It's called One Skin that we have right now, and seeing some really good results with that for patients. And same thing with what else we have for beauty. We have different like beauty IVs with collagen. The red light beta is great for that, to rebuild collagen. Yes, we're gonna start introducing microneedling soon as well at the clinic, so that's gonna be fun.
So when you say though peptides, I'm sorry, I still don't really fully get the whole idea of the peptides. So when you say that in skincare, so I know there's creams and all this. So what would a peptide do in skincare? Why would that make any difference versus any other skincare?
So with this peptide specifically, it focuses on zombie cells, so it helps break that up. So doctor might probably
Zombie cell is in zombies?
yeah.
Okay.
Doctor may explain
Yeah.
it better, but the way that I understand it is that there's three stages of a cell. So a healthy cell, and then the cell dies, and then the cell breaks up. So zombie cells are those cells that are just stuck in the middle and they don't break up. So this peptide helps move that, and that helps like reduce wrinkles, lines and wrinkles, and just overall appearance of the skin.
Yeah, so the technical term, I guess, would be senescent cells. So these,
I'll stick with the zombie cells. But
Easier,
what?
yes.
so they sort of get stuck in this lifestyle, in this cycle of their life cycle, and they can't move forward. So they should move forward in either apoptosis, which is programmed cell death, or they should divide and keep being a cell, but they get stuck in this senescent phase. And so people refer to them as the zombie cells. And that's one of the big things, even intermittent fasting or fasting in general, it helps your body to clean house, to basically break down these zombie cells or senescent cells. So one thing, somebody told it to me one way that always stuck. We think of things like supplements, right? So if you think of a supplement, and again, the car analogy, as being a spare tire. So we take supplements and you're getting all these spare tires. But when you get a flat, you have to take the first tire off first, or you could have a truckload of spare tires and they won't help. So that's kind of what one way that's easy to think of is removing those senescent cells. You're breaking down, and you can also recycle a lot of those cell products. So that's a big part of anti-aging. Again, a lot of times aging relates to senescent cells. We get more cells stuck in this phase of their life cycle, and they need to be convinced to move forward. So the peptides, yeah, peptides confusing for a lot of people, but it's really, like Veronika said, a chain of amino acids.
Okay.
If it were longer, it would be considered a protein. If it were shorter, we just call it amino acids. So they're naturally occurring. Just when they occur in a specific sequence, they signal the body to do something. So another reason that we like it, we like all of that stuff like platelet-rich plasma, where you're using the body's own healing mechanisms to heal the body. And the peptides, Veronika mentioned too, there's peptides for, to strengthen your immune system, or there's a lot of peptides for healing or increasing growth hormone or helping you sleep. Lots of options for peptides. And it goes back to using the body's own mechanisms to do these things, which is why we're such big fans.
Got it. So I really appreciate you guys coming on. You're our first medical professional. We've been doing quite a few episodes now, and as opposed to just talking about health insurance, we just really thought it would be great to have kind of the other side of it on. So this, I think, went really well, and I appreciate you guys being our first guest on this side of it, including bringing the doggy with. And yeah, and I know I talked about ACA a moment ago. I just want to kind of clean it up a little bit. So health insurance for individuals, that's what the Affordable Care Act, or ACA, where we get subsidies, and a lot of times references Obamacare. So that's so that's where I was getting back into with that house savings account and being able to do that. But to round up, any last thoughts you want to go ahead and give the name of your practice one more time, and any last thoughts you got?
Yeah,
We let Veronika
Yeah.
go first. Ladies first.
Yeah.
So the name of the practice is ThriveMD. We're in Schaumburg, Illinois, and yeah.
Perfect. That's
Sorry.
good. Doc, you want one last?
No, ThriveMD.com. And, I think a lot of it, we've talked a bit about how to choose someone or how would someone get started, that sort of thing. And I think it's a lot like you guys, how you help people through the process and pick, I don't know anything about insurance. So when we first talked about it, I was just lost, and you kind of guided me through that. This is what you might want, and we consider these things, and it was really helpful. And that's I think that's sort of the way that we do it too. People come in there and I just want to be healthier. What does that mean? It depends what that means to the person, how much time and energy and money they want to dedicate it to it. But I think being open to the idea is sort of the biggest first step. And then there's a lot of different options. It doesn't have to be full on like it is for some people, but you can do things quarterly, and that makes you healthier. Little things add up to big changes.
So I'll ask you one last question on it, since we are, broadcast nationally, and you're with local here, and I guess I'm putting you on the spot with that, but I guess depending on your answer, we're still going to go with a yes on it. If someone from Arizona or Florida or New York wanted some help finding a local practitioner that can do what you guys do, could they at least give a call to the practice, and you guys can, whether you get them a website to take a look at I'm sorry, what was the name of that association again?
Well, there's a couple of them, but American Academy of Anti-Aging Medicine,
Okay.
A4M is a big one.
Okay. Or if they called and you let them, would you be acceptable to have a call come in from someone?
Oh, of course.
Okay.
Yeah, we're here to help.
Okay, good. Nice. That was a good answer. That's a good wrap for today.